One of the point of care tests that your pharmacist may do, and if you do advanced point of care you may do, is called a finger stick. We simply use a lancet to get blood out of the patient's finger. Even if you're not doing this stick, there are some things you can help your pharmacist with before the patient comes to the counter. The first one is your pharmacist needs the safety lancet. So you're going to have those ready. They may be in a box. I just pulled out one. Have to have a sharps container. If we're going to make somebody bleed with something sharp, it has to go in the sharps container before anything else. And I have a trick I'm going to teach you so you can teach your pharmacist. When I make somebody bleed, I want to put a Band-Aid on it. The problem is, once I put my sterile gloves on, because I don't want them to bleed on me, I want them to bleed on my test, it's really hard to open a Band-Aid, and then, once you get it open, the problem is they're sticky, and you're trying to get it on the, so you end up with the Band-Aid stuck on your glove. The secret is, don't do this. I'll show you the trick. The trick is, open the Band-Aid before you put on your gloves. You take the Band-Aid, you open it up, I think. You take the Band-Aid, you open it up, and then when you look at the back, you'll see that one piece comes off pretty easily. Stick it on your lab jacket, then even wearing gloves, I can pick it up, put it on the patient without gluing my fingers together. Now I'm going to show you what it looks like when we do a finger stick. I'm going to use my own finger, but I'm still going to put on a glove because we're not drawing blood in anybody except ourselves without that. The law says that your pharmacist, or you, has to use a safety lancet. So we can't use the AutoClicks or whatever it is that we grabbed out front. We have to use a device where the needle will come out and go right back in. To open a safety lancet, you simply remove the original safety feature, which is right here. This is a discarded piece. We then take the lancet, put it flat against the finger, push the button, and the blood is drawn. With some tests, I will test this drop of blood. With other tests, I'll wipe away the first drop, but see, since there's no alcohol wet on my finger, I get a nice rounded top, and I can draw that blood in whatever form the test wants. And then we can go back to the Band-Aid that I've stuck on my lab jacket. I stick the sticky end down on the patient. Now I can pull off the other side, pull it across, and my patient has a Band-Aid without sticking it to my gloves.